Commissioner Wilson.
Present.
Commissioner Killeen.
Here.
Commissioner Garza has requested an excuse. Commissioner Kniezek. Chair Dobb.
Here.
You have a quorum present.
Thank you. Next item.
B, Chairwoman's remarks.
I have none. Next item.
C, approval of the January 15th, 2025 meeting minutes.
Approval of the previous minutes, Madam Chair.
It's been moved and supported. Any discussion on the meeting minutes? Hearing none. All those in favor, please say aye. Aye. Any opposed? Any abstentions? Motion passes. Next item.
D, unfinished business. There is none listed.
Next item.
Moving to item 1, under new business, forwarding a final copy of the Office of Legislative Auditor General's Performance Audit Report on the Wayne County Department of Health, Human and Veteran Services Federally Qualified Health Center process.
Okay, I'll turn it over to our Auditor General, Marcy Cora.
Marcy Cora, Auditor General, and
Erica Jones, Principal Senior Auditor.
I believe we have some representatives on Zoom, if they could introduce themselves.
Yes, Kamal Keparu, Finance Director for the department.
Mr. Jackson, I believe, is also online.
Yeah, he's on mute. Like he working to get it off muted.
Mr. Jackson, can you hear us?
I can hear you now.
Okay. Can you just introduce yourself for the record, please?
Good morning, Javar Jackson. I'm the CEO of the Federally Qualified Health Center through
Thank you.
HHPS.
And I'm not sure if we have anybody else representing federally qualified health centers. Guess that's it. What you have before you today, this,
We have
I guess we do.
Hi, good morning. Avnisha, Clinical Care Services Division Director.
Thank you. What you have before you today, this is the Department of Health, Human and Veteran Services, Federally Qualified Health Centers Performance Audit. And I'm going to turn it over to Erica Jones. She's going to go through some of the preliminary information and the first finding, then I'll go through a couple and then I'll turn it back over to Erica Jones.
Yes, our engagement objectives were to assess the county's on-site monitoring of operations and assess control over federally qualified health centers' payment for services. Our engagement was conducted in accordance with the generally accepted government auditing standards, and our engagement scope was for the period of October 1st, 2021 through September 30th, 2024. We held discussions with executive management within the clinical services and finance divisions of the Department of Health, Human and Veteran Services, and with executive management that was hired by the Southeastern Michigan Health Association to solidify our understanding of the FQHC operations. We also examined documentation that was provided by HHVS and SIMHA management to determine whether adequate controls were established to mitigate the current risk exposures within the FQHC processes. The Department of Health, Human and Veteran Services Clinical Service Division receives grant funding from the U.S. Department of Health and Human and Veteran Services, HRSA, to operate the 2 federally qualified health centers known as the Wayne County Healthy Communities. Wayne County Healthy Communities was formed to provide primary health care services and other health and social services to low-income individuals and families. Wayne County Healthy Communities was awarded the FQHC status in 2012 and aims to provide health care services to community members regarding $2 million in federal grant monies each year during our scoping period. HHVS finance personnel must timely submit drawdown requests in the payment management system to receive a disbursement of the awarded grant funds. In October 2020, the county executed a 5-year contract agreement with SIMHA to obtain assistance in the execution of 26 health programs, of which the 2 federally qualified health centers are a part of. The total SIMHA contract is currently valued at $57.9 million and expires on September 30th, 2025. Over the audit scope period of October 2021 through September 2024, the county remitted a total of $6.4 million in invoice payments to SimHi for the FQHC business units for rendered services. The county will continue to remit these recurring invoice payments during the duration of the contract term. Based on our audit, we identified 5 issues and 13 recommendations to strengthen the internal control environment within the FQHC processes. 2 of these issues are classified as significant deficiencies, and 3 of these issues are classified as control deficiencies, which are deemed to be low risk. We discussed the 5 issues and 13 recommendations of representatives from the HHVS Finance Division and SimHi to obtain their concurrence and or disagreement. Management agreed with 12 of the 13 recommendations that were discussed within the 5 issues. Our first issue was entitled, and it's on page 9, the county did not submit salaries and positions listings prior to contract execution. At the start of the SimHi contract, the county was required to provide SimHi a budget, including a list of titled positions, job descriptions, including qualifications that are required for the positions that are needed to operate the FQHC. The county was to also approve any subsequent revisions that are made to initial salaries and positions listing. We requested for HHVS management to provide the requested listing of titled positions, qualifications, and pay scale data that was provided to SimHi at the beginning of the contract period for the FQHCs. However, we instead received a budget narrative report that was prepared by SimHi management. SimHi management also provided copies of an employee roster with pay information, along with copies of job descriptions and resumes. However, it was confirmed that these documents were internally generated by SimHi and were not provided by the county. We also compared the budgeted positions that were listed in the SimHi budget narrative report to the actual positions that were listed in the SimHi employee roster and noted several discrepancies. For instance, we noted that the SimHi budget narrative report contained a total of 21.8 full-time equivalent positions, and that the SimHi employee roster contained a total of 26.8 full-time equivalent positions, which created a variance of 5 positions. We also reviewed the SimHi financial status reports and noted that a total of $1.6 million in salaries had been expended by SimHi during fiscal year 23, which was approximately $155,000 over what was budgeted. We also determined that several of the SimHi positions had a higher salary amount than what was budgeted. However, no support was provided to evidence that the county had approved these salary increases at any time during the contract term. Our recommendation was to ensure that management's compliance with contract provisions, we recommend HHVS management establish procedures that will require any future programs requiring SimHi staffing to ensure that initial listing of positions and job descriptions are provided, and that any changes to positions or salaries during the contract period are forwarded to the county for review and approval by HHVS management, and that they document their approval. Management disagreed with this recommendation.
Okay, Marcy,
I'm just not sure if anybody from Federally Qualified Health Centers have any comments on the disagreement with this recommendation.
I mean, I can, Kamal Keperu, Finance Director for the department. I can start off, and I guess one of my colleagues could chime in. Yeah, the disagreement basically stems from I guess I'm the person that's been there the longest. I do know there was plenty conversation between the department leadership and the FQHC throughout this period, but obviously the documentation of it was a little weak. But the FQHC did not just hire folks without discussion with a division director who was responsible for overseeing all the FQHC operations. So that was the essence of the disagreement, that I know it was oversight, but I guess it just wasn't, obviously it just wasn't documented. But going forward, to remedy that problem, because it was a structural problem that we talked about, that the way we're going forward is that the FQHC will be handling its own semi-contract, whereas previously, from the inception of the FQAC contract to, I guess what, last year, someone can correct me on the date, the county was responsible for the FQAC contract, but all the hiring and everything went through the FQAC. So structurally, that's what kind of caused a lot of discrepancies of going back and forth. So I'll stop there if there's any questions, need clarity.
And I could just add too, I think what Kamal was saying is that same thing, our recommendation is that for the SEMHA contracts, any changes in positions, salaries should come to the county for approval and they should be documented. And I think the issue was not being able to obtain any documented approval of the changes. While they may have been verbal, it needs to be documented so there is an audit trail. Would you agree with that, Kamal?
I think we might have lost him.
And I can chime in. Kamal might be having some technical difficulties, but Avnisha, Division Director of Clinical Care Services. And yeah, so I think, what Kamal described is accurate in terms of our processes in place. The Director, CEO of the FQHC is actually a county employee. That's Javar Jackson right now in that role. At the time of the period of this that was being that this audit contained, he wasn't necessarily in that role, and there were myself and other folks at HVS served in that role. And so, yes, all of the changes in staffing at the FQHC level, whether it's positions or salaries or change in roles, would have come through whoever was serving in that interim CEO role or the division director. But in these instances, perhaps that kind of documentation of approval was not able to be provided. And so we do understand that. And then to Kamal's also point that he raised is that, moving forward, the health center will be directly contracting with SEPA. So I believe that some of these layers will be much more seamless and monitored more closely as a result.
I agree.
Okay, great. Any commissioner questions? Commissioner Colleen?
Thank you, Madam Chair. Yeah, a few things here I want to clear up in my mind. SEMHA prepared the Wayne County budget narrative report for the county budget policy statement and not Wayne County staff.
The report we received came from SEMHA. It was prepared by them.
Sorry.
Yes, you're correct.
And the fact that we have two different numbers on FTEs here, what I'm trying to understand in management's response, if I understand them correctly, SEMHA is going to oversee this contract now and the county won't be involved?
Through the chair, before it was set up, the contract was through the contract with SEMHA was with the county and SEMHA, but all the management of the staffing was at the FQHC, which caused a structural problem with the movement and hiring. Right. And in that's why you saw a lot of the discrepancies. Going forward, the contract would be directly with the FQHC, and the county oversight would just be from a budgetary standpoint only. Whereas before that contract between SEMHA and the county, basically the county was just responsible for paying the bills, but didn't maintain consistent control, should I say, with the hiring or the movement around the staff because of the separation. Does that make sense, Commissioner?
I understand what you're saying, but so except for the dollar amounts, I'll get back to that in a sec.
Mm-hmm.
How is, if they're going to manage all of this contract, including wages and salaries, and that's going to be done by the FQHC,
Correct.
then how does the county, what's the reporting to the county on who the employees are and what their wages are? And we don't, the county wouldn't have any authority in terms of setting salaries and wages?
Correct, because those employees it's the FQAC responsibility because it's their contract now.
Okay, so what's the county still going to monitor?
Just the budgetary numbers. Let me just go at it because it's one of the points later on. Here's what typically happened that caused some budget overruns because we didn't when every month SIMHA sends, the FQAC sends over a bill, right? Before we pay anything or reimburse them, we go through those bills and pay. During that period, the SIMHA bill was higher than normal, which caused the county to pick up the slack on the overage, thus us using more general fund, right? The way we're switching is that the onus would be on the FQHC now. So any budget overruns, they handle it. The only thing we will be paying is the portion of the grant. Because as a context, remember, the county is responsible for the grant. And so since the grant is, whatever the grant is, 2.2 million, we would pay them 1/12 or whatever that particular portion is, no more, no less. So when they send us a bill, if it's over that particular grant portion, they have to pay the difference with their patient pay or whatever, their other sources of revenue that they collect. That's the control has been in place now, that's going into place. Matter of fact, it's already started.
Okay.
That's how it will be controlled.
And how much did we have to transfer from general fund? That wasn't in the budget, correct? There was no general fund money going to the
Well, yes,
FQHCs?
it was a portion. It's been a portion for years, but this last year it was a substantial amount, maybe about, I think, almost $1 million.
Yes, it
Yeah.
was $1 million.
Yeah, almost $1 million. Yep.
And if that situation arises again, SEMA has the resources to cover that? Is
Well,
that how that would work?
correct. Now, do they have $1 million? I'll let Javar speak to that. But here's the point. They would have to be more diligent in their staffing, right? Instead of relying on the county just to pay the difference. No, they have to just monitor the staffing more.
Well,
And thus stay within their budget.
yeah, I want to hear from my auditor in a sec, but I would think we should, I mean, if they don't have the necessary, whatever, rainy day fund, whatever, it's happened once. If it happens again, what's the consequences on SEMHA? What do we know about that? Was that part of the discussion to say, we're going to turn the contract over to you? And by the way, can you guys afford this if anything costs go funny again?
Sir Chair, if I can chime in, this is Javar from the FQHC. One of the challenges or opportunities that we needed to improve upon was there was one existing budget that existed only on the county side, and the FQHC didn't have an operational budget as far as the staffing component. And so when we had the negotiations of the contract with SIMHA, it had to be at a point in the future of what the operational budget can handle with that opportunity to match what's happening at the SIMHA level. And so monthly, we have an FSR, which is a statement of funds that is reviewed both by the FQHC as well as by the county to ensure that we remain within the budgetary confinement that SEMA
And
has.
excuse me, that's a report that goes to the feds, right?
Correct.
Yeah.
That is a document that is also auditable even from HRSA perspective. of where the funding, since we're using federal funds to pay for the staff, it is something that they also look for during our annual audit as well as during our 3-year operational site visit. The opportunity that we've installed, as you know, since I've been in seat since October, is that we've worked on having an operational budget at the FQHC that identifies how many staff can be supported by the budget, suggesting again that at any given point that we're, you know, having a funding challenge. We look at 80% of that grant that we receive from the HRSA supports all of those staff. And so no more nor less is coming out of that grant. To Kamal's point, as far as the patient revenues are perspective, that the way that our budget has been set up, the residual, so the additional 15% that is comprised of other grants as well as of our patient revenues is only for the operational expense. And so that by how we've set it up, we won't have any overages in that case. If we do have an overage, for example, you know, we have a staff member who has overtime or we add an additional staff, we have funding within our reserves as well as within our operational budget to support that overage. It's to kind of speak to, again, the conversation about our ebb and flow with SEMHA. SEMHA, we are currently at a zero balance budget with them, which means that we only can expend to them what we have within our budget. So we don't have any rearage there, if that makes sense.
And through the chair, Commissioner Killeen, and the county know we won't leave them hanging. We have discussed with the FQAC on multiple occasions, and the county will continue to assist, but we just had to collectively come to agreement to put some control mechanisms in place. And so that's the genesis. But no, if the FQAC run into some financial issues, we will discuss it. And again, we meet with them on a monthly basis anyway, so we had know prior.
Okay, and this has been kind of a systems discussion, having the right systems in place.
Correct.
To oversee. And my questions are around the fact, I mean, I love the FQHCs. I love that we're providing some primary care in a county that is well underserved for primary care physicians. I don't want to endanger that in any way. So this is where my questions are coming from. Have we put something in place here? Because we also got the feds looking over our shoulders on this too. And there's no messing around with that. So, you know, I need to know as a commissioner that, yeah, we've had some problems and now we're putting the right thing in place. And my questions around that are, my understanding of, is this the right thing to do? So I'll leave that go, Madam Chair. Thank you.
Marcy.
Our next issue is the FQAC program revenues were not appropriately budgeted. According to the Wayne County budget policy statements, when you're putting together your budgets, the departments and elected officials are required to prepare and submit budget requests that support their mission and stay within their approved budgets for the year. We reviewed the county's general ledger for the 2 FQACs and determined the amount budgeted for grant revenues was significantly higher than the actual grant awards. We specifically noted, and the budget was in excess of grant revenues in fiscal year 22 and 23. The county had budgeted FQAC revenues and expenditures in the amount of $4.7 million, while the actual grant revenue was only 2.2. Therefore, it was $2.5 million budgeted more than what the actual grant award was. We also noted in reviewing the general ledger that there was incorrect postings of grant revenue. In fiscal year 2022, the actual grant revenue recorded in the general ledger for the 2 business units was combined at $2.5 million, or $0.3 million more than the federal grant award was received. And in fiscal year 23, the actual grant revenue recorded was $1.4 million, or $0.8 million less than the grant revenue was received. We were able to determine that all of the grant revenue each year was drawn down. In the grant award year ends on May 31st. The county's fiscal year is September 30th. The issue was in how some of the transactions and accruals were recording, which we believe is what contributed to the difference in the 2.5 and the 1.4. Actual expenditures were in excess of grant revenues. For fiscal year 23, the county recorded the 1.4 in grant revenues. However, actual expenditures were $2.6 million, which resulted in expenditures in excess of revenues of $1.2 million. We noted that $238,000 was transferred from the FQAC to help cover some of the shortfall. When we talked to HHBS Finance Management, they stated that due to short staffing, they were unable to reconcile the FQHC program budgets to the HRSA grant to ascertain accuracy and agreement. They're also unable to explain how the federal grant revenues and accruals were recognized in the general ledger. It appears to us it was just some posting errors. So our recommendation is to ensure that budgets are prepared based on the actual grant awards. We recommend that HHBS Finance ensure that the FQAC program budget is reviewed and grant revenues and expenditures are based on the actual grant award. Perform a monthly or quarterly reconciliation of the grant revenues received to the general ledger, and then monitor the FQAC expenditures monthly to ensure they're in alignment with the budget. And management agreed with the recommendation.
Okay.
Great. Comments?
Any comments from the FQHC?
No, I'm fine.
Okay.
The next finding was general fund
Oh,
transfer.
sorry, commissioners, any comments, questions?
I'll be back.
All right, proceed, Marcy.
The next one, general fund transfers to the FQAC program. We also found the county had improper transfers to the general fund for the FQAC program during our scoping period. For fiscal year 23, we found that the two business units had a combined deficit of $921,644. This was primarily due to the incorrect budgeting of revenues and expenditures, and the resulting excess payments were made to somehow for rendered services. When we looked at the general ledger for fiscal year 24, while grant revenues were appropriately budgeted at the 2.2, we found that the two business units ended with a combined surplus of $1.2 million. This was mainly due to identified transfers from the general fund that totaled over $1 million. The two business units had budgeted clinical services chargebacks of over $1 million, while the actual expenditures for those chargebacks were about $442,000. An additional chargeback was also recorded in the amount of $418,000, but the chargeback was not budgeted. This contributed to the surplus. The money's coming in from the general fund. In fiscal year 25, we noted that the two business units had a total of $1.6 million budgeted for general fund transfers, along with clinical services admin's chargeback budget of over $1 million and $181,000 in the personnel costs. When we spoke to representatives from HHBS Finance, they believed that the transfers for the general fund was going to be about $150,000 each year. Our recommendation is, in order to lessen the burden to the general fund, we recommend HHBS Finance budget expenditures, including chargebacks that are reasonable, accurate, and supported. Only budget the required general fund transfers to cover those expenditures not covered by the grant, and ensure all excess expenditures for professional service contracts not covered by the grant are not submitted for reimbursement. And management agreed with this recommendation. And I believe yesterday at Ways and Means, there was a decertification of about $1.6 million. And Kamal may add to it, this may be decertifying the $1.6 million in general fund transfers. Is that correct, Kamal?
No, but that one
No,
is
okay.
forthcoming. But
That's
you have my
forthcoming,
tongue,
okay.
you have my tongue bleeding over here. But your analysis was spot on, and that's the example I was going to use, showing that we getting our rhythm. Meaning, what was on Ways and Means yesterday was an example of the point of the budget. Meaning, whereas before, where the budget was overstated because we didn't have time to decertify funds. So yesterday, what you saw in Ways and Means was the grant being certified, but us also decertifying funding, which would reduce the budget and moving it to the new year. That didn't happen during the audit year. During this review year. The second part of the general fund, I did look into the ledger. We will be submitting a budget adjustment, removing, I think it's 1.6, whatever Marcy said, from the FQAC general fund. And as Marcy said, initially we talked about 145,000, but we as a department agreed to pay another amount. So I think it's going to be a total about either 400,000. So I'm gonna say 400,000. So 1.2 will be transferred back to the county general fund. Matter of fact, it's budgeted, so it ain't like they got it yet. So we're just going to reduce the amount that we're allocating per budget for this particular year. If that makes sense. Any questions or comments?
Commissioners? Okay, all right, Marcy.
Moving along, rental payments made outside of the contract. This one may get a little confusing, so hopefully I can explain it. The Wayne County procurement order currently requires contracts valued over $149,999 to be approved by the Wayne County Commission. Also, performance or payment of a contract shall not commence or continue prior to the required commission approval being received. There was a contract between the county and Joseph Campbell Shops, which expired on October 31st, 2023, but the new agreement was not approved by the commission until April 23, 2024. However, based on a review of the rental payments that were remitted to Joseph Campbell for the Hamtramck Federally Qualified Health Center, we found that in February 2024, the county processed a voucher paid to the Wayne County Healthy Communities for lease payments in the amount of $28,298,000 for 3 months' rent. This was at a time when the valid lease agreement was not in place. We did some further review and found that on June 4th, a second voucher was processed to reimburse Wayne County Healthy Communities for another 4 months of rent. However, the Wayne County Healthy Communities had already paid Joseph Campbell LLC in February for 2 months' rent and 1 month's rent in March and 1 month's rent in May. While the second voucher was after the lease agreement was approved by the commission, 3 of the monthly payments were already paid by Wayne County Healthy Communities before the valid lease agreement was in place. So this is what Kamal was saying, that there's operational revenue that comes into Wayne County Healthy Communities, and this was the funds that were used to pay the lease agreement, even though the lease agreement was between the county and Joseph Campbell. Does that make sense? As a result of our assessment, there was no controls in place to require payments to be made by purchase order instead of voucher to Wayne County Healthy Community as a reimbursement. This resulted in payments being made without an approved contract in place. Our recommendation is that management budget ensure that procurements that require Wayne County Commission approval are not processed by a voucher, and payments are not processed until the contract is approved by the Wayne County Commission and an approved contract is in place.
Commissioner Kling.
Thank you, Madam Chair. I'm trying to follow the bouncing ball on this and what we're doing here. So, Semha is going to take over everything but some MMB internal accounting. Who makes the contract with this? The contract is between the county and Joseph Campbell Shops?
Correct. And it comes before the commission.
Is this something that contract? And they are, because then there's some money going back from the county to the FQHCs, right, as a result of the revenue that comes in?
Well, what happened in this occasion, because Healthy Communities has revenue that's coming in from the pay-for-service providers, and they needed to, I believe, have the rental payments made, that gave them the mechanism to pay Joseph Campo for the rent without there being a contract in place. Had just
Yeah,
other rental payments came when there was when the contract was in place, the rental payments came through the county's process like all normal procurements, and
okay.
rental payments were made.
So we didn't have a contract in place, but the FQHC made a payment to this?
And then the county reimbursed Michigan
Yeah.
Healthy Communities.
Share, so is that straightened around in the new management structure now? Is it gonna be the cost of the contract is gonna be billed to the county and the county directly pays for this service and there's no involvement of the FQHCs?
But through the chair, if we waiting, I have to yield to Dr. Sheffer Javar. I don't remember if that part, but I will say Marcy explained it correct. I'll just say it a little simpler. The bottom line is that the contract ended up expiring for whatever reason. It just
Mhm.
wasn't because of timing. And of course, with the contract expiring, the rent was still due. So we didn't want to let it lapse. So in
Right.
essence, that's what happened. Now, going
And the
forward,
FQHC would have been unaware that there was an expired contract. Would that be correct?
oh no, they was aware because we was in discussion during that time, but I don't really remember at that time it was a delay with negotiating with the landlord. I just don't remember, but nevertheless, it ended up expiring. So we wouldn't run into problems as far as contractually.
Right.
We all agreed just to make sure it's paid, and once the contract get approved by the commission to reimburse, right? But going forward, Dr. Sheffield Javar, what's the, I know we
Yeah.
adjusted the semi-contract, but
Right. So the county still holds the contract for this lease. And
okay,
so I think what Kamau described is correct in the sense of, I think it was a scenario where the contract was not in place and the new PO wasn't in place. But to Commissioner Colleen's point, yes, we're being very mindful of making these processes more seamless. And this is one area that we do support the health center in, is supporting this lease relationship for that space, and processing those payments.
All right. And Madam Auditor General, you're going to do a follow-up on this?
Yes,
Because we have some fairly significant changes uh, in a management way that is being discussed here. And
yes,
again, I'm very nervous, and I'll ask about it later. I'm very nervous about federal support for these programs. And, that we have everything down. So at least that can't be a weapon that's used against us, that we're not managing it properly, because these primary care services, and I got reports all over the place in my office about how bad it is for Wayne County residents to get medical primary care. And in no way I want to endanger that. So,
what will happen 30 days after the report is issued, we'll request a corrective action plan. They'll submit their corrective action plan. We'll do our assessment, then it'll be presented to the commission. I just wanted to add too
Okay.
that the contract with the county and Joseph Campo goes through October 31st of 2028.
thank you, Madam Chair.
We'll move on to our last issue. Eric will take that.
So, yep, our last issue was entitled Controls Over Patient Payments Could Be Strengthened. It begins on page 15 of the report. To assess the control environment over the safeguarding of receipts, we conducted walkthroughs with the former CFO to determine how patient payments are currently received and processed at the two healthcare centers. Based on our walkthroughs, we determined that the FQHC officials do not have adequate policies and procedures in place to ensure that a log is prepared for mail-in receipts or segregation of duties so that the same individual is not opening the mail and depositing the receipts. We also determined that there is no policy to ensure that a daily reconciliation is performed over the patient payments that are received, recorded, and deposited at the bank. During our walkthroughs, we also confirmed that approximately $575 in cash had been stored within the CFO's office as of August 2024. According to the former CFO, the cash funds are stored within a safe for several months and contain both petty cash funds and patient payments. Therefore, we determined that the FQHC had not established adequate controls to ensure that cash funds are properly segregated and are timely deposited at the bank. Not having adequate controls in place over cash receipts could result in the risk of loss and or misappropriation of receipts. To enhance the controls over patient payments received at the FQHC, we recommend policies and procedures are revised to include someone outside of the CFO open the mail and prepare a log of mail-in payments prior to providing to the CFO and immediately endorse each check. We also recommend that each day a daily transaction report is run of the daily receipts that are posted to the ECW system and are reconciled to the actual receipts that are given to the CFO or they designate for deposit. The CFO to also perform a deposit of cash receipts at the bank at least monthly and to retain copies of the bank deposit slips for third-party review and ensure that all cash receipts are maintained separately and are not commingled with petty cash. Management agreed with these recommendations. We discussed the issues and corresponding recommendations with representatives from HHVS Finance Division and SEMHA. Management agreed with 12 of the 13 recommendations within the 5 issues. We also have included management's responses to the issues and recommendations within the audit report. And as Marcy said, a corrective action plan will be requested approximately 30 days after the report is formally received and filed by the Wayne County Commission. We are now open for questions and comments.
Okay, I just want to go back to that last finding, the controls over patient payments could be strengthened. Were there any responses from FQHC on that?
Yes, this is Javar from the FQHC. We recognize that we needed to strengthen our finance department from a checks and balances perspective. Again, with having a smaller operational budget, there was more focus at the time on strengthening our clinical staff as well as some of the other, patient-facing activities. But in my first tenure here with the health center, we've embarked on improving not just the checks and balances, but also our workflows around our financial handling, such that we've installed currently a director of finance as well as plans for an accounting clerk and accounting staff, so that we have more internal controls of how our finances are moving, but also that one hand doesn't have all the power when it comes to the dollars that move between the organization. I'm also closely monitoring our financial department with consultation with Kamal and his team, so that the county is consistently aware of where we stand, that we ensure that our balances are in place and that we also have a good communication trail around some of those safeguards that we're placing at the health center level.
Okay, great. Any commissioner questions? Commissioner Colleen?
Thank you, Madam Chair. A little bit of a big picture thing. What percent of the people that visit us at the FQHCs, I guess I'll term it as non-Medicaid patients? They're bringing a private insurance rather than Medicaid. What percentage do we get at the health centers that do that?
We're less than 10%. Our majority is Medicaid, Medicare eligibility, with really the most being around Medicaid and managed care.
Are you able to get any growth in that?
As far as private pay?
Yeah,
I believe so. I think
because the reimbursement rates are better.
I believe we have opportunity to diversify our patient sources and our patient panel for sure.
Okay. And my other question is, when was the last time, when did HRSA, we're in the middle of a HRSA grant right now, right?
Yes.
And we're drawing down, what do we draw down monthly, quarterly?
Currently quarterly, I believe.
And when was that grant awarded? When did it start?
The grant cycle starts July 1st through June 30th.
Okay. Has there been any indication that those funds are not available to be drawn down under the previous grant? Has HRSA been frozen in their grants? What's the situation there?
Really good question. So in general, no, we are still accessing our funds and have ability to continue our operations with HRSA support. Some of the challenges that we've seen on the federal level had caused earlier last week some wrenches in the plan, I think nationwide, when it comes to FQHCs, and a scare around the ability to draw down funds. But since that snafu earlier last week, the operations on the federal side have been restored. And there is some advocacy happening at the state and federal level with community health centers to ensure that level of connection doesn't occur, as it did before.
And am I correct that there's a temporary injunction in place to ensure, at least for now, that those funds can continue to flow from the federal government?
Correct. We had some conversations with our HRSA project team, and the life cycle of our current grant is not in jeopardy of any challenges from their perspective.
Okay, but at some point, temporary injunction turns into a different kind of an order. So I hope the money keeps coming. Go Judges. Thank you. Thank you, Madam Chair.
Just in closing, I wanted to thank the FQHC team for their support, especially Kamal Kaparu. We worked closely with him through especially the financial issues and recommendations.
Okay, thank you. All right, can I get a motion to receive and file this report?
I'll make that motion and forward it to the commission.
All right, it's been moved and supported. All those in favor, please say aye. Aye. Anyone opposed? Anyone wish to abstain? Motion passes. Next item, Madam Clerk.
F, such other matters as may be properly submitted before the committee.
I have none. Next item.
G, public comments.
Is there anyone here who wishes to make a public comment to the Committee on Audit? Is there anyone on the phone or on Zoom? Any emails?
No emails were received.
Anyone wishing to make a public comment to the Committee on Audit? Last call for public comments. Hearing none. Next item.
Adjournment.
Is there a motion to adjourn? All right. There's motion support without objection. We